Hi everyone, welcome to this month's Generation Magazine Brown Bag Lunch webinars. My name is Cynthia Arnold. I may look new. I've taken over Rick to help with the webinars for Generation Magazine. I may also look familiar because I help with the Generation Magazine Aging in Place workshops for the past 10 years. So you've seen me around, probably. I'm Cynthia Arnold. I am with Senior Move Managers in Declutter Hawaii. We are one of the sponsors for the webinars as well as the FBI, and we'd like to thank FBI for being our sponsor for the Brown Bag Lunch webinars for Generation Magazine. Before I introduce our guests today, I just wanted to give you some housekeeping. In addition to these Brown Bag Lunch webinars, which is held on the third Wednesday of every month from 11:30 to 1 o'clock, we also have our incredible radio podcast, which is every Sunday from 8 to 9 a.m. on 101.1 KORL, Hawaii's Classic Rock FM. Spectrum channel 883, and on HawaiiStream.fm. All of the radio as well as webinars are also on the Generation Magazine website, which is generations808.com. So you can go to the webpage at any time and watch old past webinars, past seminars. I think we even have some of our past Aging in Place seminars that we've had, as well as all the radio and podcasts. So thank you for joining us today. Next month, September, we will have our brown bag on September 22nd. We're not having it on the third Wednesday because we have our Hawaii Pacific Gerontological Society conference on the third week of September. So the brown bag lunch is going to be on the fourth week, which is September 22nd, fourth Wednesday. So I will be sending that email out in September with the link information, but those guest speakers will be from SHIP. Any questions throughout the webinar? Dr. Amy is gracious enough to answer questions during her presentation. So if there's some question that you have while she's talking about a specific slide, please enter that in the question and answer. The icon is on the bottom, or you can chat to me and the panelists, and we'll definitely get those questions answered throughout the webinar. So you don't have to wait until the end to ask questions and answers. However, we will have that portion later. But if there's something pertaining to one of the slides she has or what she's talking about, please don't be shy and type the question in the question and answers, and we'll get that answer for you. Okay, so let's get started. I want to welcome Dr. Amy to our webinar today. She will be our speaker today. Oh, first, I also want to, Adrian, if you want to wave hi. Adrian's with MDX as well. She's here to help support Dr. Amy and help answer any questions you may have. So Dr. Amy is a family medicine physician. She's the medical director at MDX Hawaii, a local healthcare company. She came to MDX Hawaii in 2017 after working as a hospitalist in Albuquerque and in Springfield, Illinois from 2011 to 2017. She obtained her medical degree at the University of Illinois and completed her residency at Carle Family Medicine residency in Illinois as well. She currently now lives on the Windward side. Yay, I'm from Windward side too, with her husband, who is also a physician. So MDX Hawaii MDX Hawaii Physician Network represents over 630 top primary care physicians, wow, and more than 2,200 leading specialists and 22 hospitals. Oh my gosh, awesome, right? Their network physicians provide exceptional care for nearly 39,000 Humana and United Healthcare Medicare Advantage partners, are actually patients. MDX Hawaii is headquartered in Honolulu and has been serving the people of Hawaii for over 36 years. Oh, almost older than me. As a local company, they invest in local communities, which is really important, especially for our communities here on Oahu and in Hawaii. You know, it's we're really about the community and the family. So that's awesome that they really invest in our communities. They support the local economy with 100+ employees in the state of Hawaii, and also part of the Hawaii community. So take it away, Dr. Amy.
Yes, thank you so much for the introduction, and it's such an honor to be with you all today. And if you're joining us on the webinar later, welcome as well. It's just a real privilege and a pleasure to reach out and to share a little information that I hope you find useful about annual wellness visits and other information as we go through. I totally agree, though. I really wish we could be doing this in person. I so enjoy interacting with people, and I'm really hoping that eventually, as we suffer the storm a little bit more with COVID, that hopefully that'll be a thing of the past very soon, and we can gather again safely and be able to interact. But I totally agree. If you have any questions, please don't hesitate to put a question in the Q&A or the chat. Stop me. I'd love to have this be as interactive as possible. There will be time at the end for questions as well. But yeah, hopefully we'll just get started, and hopefully we'll have a good discussion, and hopefully you find this useful. So thanks for joining us, and open up that lunch. If you've got lunch, feel free to eat. That's the nice thing. All right, so I am just gonna advance here. Hopefully everyone can see my screen. So that's me. I'm a little more dressed up there, but that's me. I'm medical director of MDX Hawaii, as mentioned. And it's just I love, this is my community now. I love serving the people of Hawaii, and just really appreciate being embraced with open arms with this community. And myself and all the other members of MDX Hawaii, we go to work every day to serve you and our community and hope to make your lives better. Just a little bit of history. In addition, great in the intro as well, but yes, we are a local company. We've been in Honolulu County serving the community for 35 plus years in various iterations. We have over 120 employees currently employed that work in the state of Hawaii to serve our community. We have 2 full-time medical directors, myself as well as Dr. Lum, who's also on here today to help you out. He is an internist and emergency medicine physician. We serve at the pleasure of our network physicians and do our very best to support them in caring for the people of Hawaii. We also are very lucky to have 2 pharmacists, clinical pharmacists that work on our team that also support the physicians and you. We have a dedicated team of social workers, nurse practitioners, and care managers who are RNs as well to serve you and help our providers. We do, from an insurance standpoint, we do have a side of that, and so we process claims locally in Hawaii to hopefully ease that transition. And we have provider and customer service support located in Hawaii. So when you call us, you speak to someone from Hawaii. And we have almost 40,000 patients that we serve with our network providers. So we really take our job seriously, and we want to be here to help you and better your health and support our physicians and you in our local community. So as mentioned, our network is, we have an awesome network of docs and providers, nurse practitioners, physician assistants, and their staff. Over 630 top PCPs and over 2,000 specialists, 22 hospital contacts. These are some of the hospitals that our patients go into and that we support. We're on all islands except for the Big Island. We do have a few patients on the Big Island, but the majority of us in Maui County, both on Molokai and Lanai, as well as Maui, as well as Kauai, and then obviously in Honolulu and on Oahu, all areas of Oahu. So we mentioned that we have a team of dedicated nurses and nurse practitioners, pharmacists, social workers. We all, so we have care management programs that can support you as well as our physicians. We invest in patient care and support them in caring and managing patients. So we have a high-risk patient management program where a nurse practitioner can come to your home. There are some that just cannot get out into the typical brick and mortar or the buildings of your providers. And so in between seeing your provider, we can offer that service to have them come to your home to help you with an annual wellness visit, as well as anything that you need to manage your conditions. We also have, we can call you on the phone and spend time with you over the phone with our nurses to help you if you have conditions such as diabetes or trouble with your sugar, kidney trouble, heart trouble, such as congestive heart failure, lung trouble, such as COPD. And we help you understand your illness. We help you work with your physician to make sure that you understand the plan that he or she has for you, understand your medications. Remember, we've got those pharmacists that can help. We also recognize that when you come into a hospital, as you leave that hospital, that's a very scary time. So we do whatever we can to help support you during that time and get you back in to see your regular doctor and your specialist as you heal at home. And then we obviously work with our pharmacists to make sure that you have access to your medications and know how to take them. This is all in service to our network providers, our physicians, and our hospitals. So why we do what we do? We are a Medicare Advantage company, or we help United Healthcare and Humana service the population in their Medicare Advantage company, because we believe in the transformation that's currently occurring in healthcare in the United States. We want to go away from the model of only going to see your physician, only going to see your doctor when you're sick, and needing that advanced care. We think it's really important that you see your physician even when you're feeling well, so that you and your provider, your nurse practitioner or your physician assistant can really understand what's going on with you, maybe catch things that's starting to become an issue with you, and hopefully prevent them from becoming an even bigger issue. We want to make sure that we put you in front of them so that we can focus on your wellness, not just cure your illness, but focus on your wellness and prevent serious illness. And so, that's hard to do in the way healthcare was originally set up. And so we're going through this transformation right now, and we're big believers in it. And we need to, because, the baby boomer generation is real, right? And so by 2030, 72 million people are going to be the age of 65 and older, our golden year citizens, our kopuna. And so we want to make sure that we do the best we can to make sure you're continuing to seek care. And stay as well as possible, and hopefully stay at home even. And we recognize, in recognizing this, we have gotten backing from the government and Congress to expand preventative services to make sure that we screen people appropriately for diseases or conditions, so that we can hopefully minimize the impact to your life, so you can continue to be well for as long as possible. And we definitely focus on preventative services to delay the onset of disease, reduce complications, let you stay happy and healthy at home, aging in place, as you heard before. We really want you to be in your community, enjoying your later years in life that you've earned and deserved at home, with not as much burden of your illnesses, or if you should happen to have an illness, care for it well, and so that it impacts your life as little as possible. So to do that, one of the main things that we help do is we really kind of look at, let's make sure that we are focusing on the behaviors that will keep you healthy, to remain as healthy and independent as possible. And when we look at the data, actually, fewer than half of adults over 65, remember that's going to be 7 million people come 2030, fewer than half of those people are getting preventative service, are seeing their physicians when they're well, to really look into their health conditions and use those preventative services to keep them healthy. So we've got to change that. So Medicare has allowed us, they've really changed it and said, okay, how can we focus on making sure that you do get in there, and raise these numbers from 33% of women and 40% of men who really just, only 33% and only 45% of women and men respectively actually get these preventative services. We need to do better than that. We need to make sure that we can do whatever we can to increase that that number. We'd love to see 100%, but certainly improve. We can do a lot better than 33% and 40% of men. And so one way that we do that is to do what's called a Medicare annual wellness visit. This is when you're feeling well. And this is time with your doctor, time with your provider, to really focus on what's going on with me, what's potentially going on with me, and what can I do to keep myself well. This can happen yearly as a Medicare patient. So this is something that is free to you. This is something that you don't pay for. This is time spent with your physician specifically to keep you well. And you can do that once a year, once a calendar year. It doesn't have to be 365 days from your last one. It's once a calendar year. And it gives you the opportunity to explain to your provider, to have that conversation, to figure out what your health status is and identify risk factors that you have, and hopefully have a personalized, what do you need to do, and what can your physician or provider do to help keep you well. Who qualifies it? Anybody that has Medicare. So everybody that has Medicare, whether it's fee for service or whether it's Medicare Advantage with Humana and United, have access to this. And again, it's, when you first come into Medicare, you get this welcome to Medicare physical and preventative visit. And then after that, you have your annual wellness visit. So that's every year after that welcome to Medicare visit. And again, every calendar year, not every specific year after the first one. So this is something that you can do every single year with your physician and your provider. Excuse me. These are just a few of the things that your provider can, there's quite a lot of this. This is a lot of things that you and your doctor and your provider can actually talk about and see if you qualify for in preventive screenings, to recognize, common things that happen as we all age, as we all get a little bit older. Our risk of having super scary things like certain cancers, like colon cancer, breast cancer in females, prostate cancer in men, lung cancer, all of those things, there's screenings that can be done, and your doctor and you can decide if you're at risk for that and if you need to get screened for that. Things like, as everything starts to wear and tear in our bodies as we get a little bit older, some of our blood vessels can get a little bit older as well. And so things like blood vessels that get a little weak can cause balloons that can rupture, such as the big vessel that sends blood to your heart or takes blood away from your heart to the rest of your body, your abdominal aorta. There's screening for that can be looked at as well. There's certain things, screening for diabetes, which can certainly have devastating effects on your health. If not caught early and controlled, it can affect your vision, it can affect the way your kidneys function, which is essential for life. It can affect how your nerves work in your arms and legs, and can cause some sores to develop that can become infected. And it's the number one cause of requiring pieces of you to be cut away, especially in your legs, due to wounds that don't heal. All of that hopefully can be caught early and prevent those long-term problems that happen with diabetes. Certainly there are preventative vaccines that can be done, tried and true vaccines such as flu shots every year to make sure that hopefully you stay safe from that. There's the pneumonia shot, there's the chickenpox or varicella shots for shingles. Certainly now we have COVID that we have to think about, the COVID shot as well. So all these things can be assessed at your visit, and seeing if you're at risk for any of these and making sure. The other thing I want to call out here is also depression screening. As we get older and as we face this pandemic in the last year plus, and probably gonna have to face it for a little bit longer based on kind of what's happening, we want to make sure that your physician spends some time with you to see how your mental health is doing. It's equally as important as all the things on this screen, like cancer and diabetes. And we want to make sure that you're doing okay, that you are mentally as healthy as your physical health. And so this is time that you and your physician can spend to make sure that there's that you're doing okay with that too, and quick screenings and then further deep dives as needed. Also, one thing that we worry about in seniors is nutrition too. Our bodies, as we age, we need nutrients even more, sometimes different nutrients that we were when we were little. We want to make sure that you're getting the right food, you have access to the right food that'll keep you healthy. As we get older, sometimes it's harder to get around the kitchen, it's harder to get out to the markets, and sometimes convenient food is easier, but that can have devastating effects on your health, such as heart disease and diabetes. And we want to make sure that you understand how to keep yourself healthy, making smart food choices that will keep you young and vibrant and healthy as you go on, and make sure you have access to the food that you need. So all of these things can be talked about and screened for during this visit. One thing I don't see on the slide, but something I want to mention as well that happened during these visits is you can also speak to your physician and your provider about what your wishes are. Like, what do you value in life? What do you want to see your twilight years to be? What's important to you? If God forbid, if you should become so sick that you have to make some tough decisions and your life is very challenging. Like, what's important to you? So advanced care planning, making sure that you have a plan in place and that your loved ones who may have to be the voice for you if you're not able to speak on your own or understand what's going on. Having a plan in place of what's important to you, so the decisions that you would make, if you were able to make them are honored and you live your life the way you want to live. That's also something that we go through and your physician will and your provider will go and talk with you about during these visits. So it's a really cool visit. I love doing them personally as a physician, and I see that it's definitely a change of pace from your normal visits where you go and it's all about let's talk about your blood pressure. Let's talk like this is just really you certainly do talk about your blood pressure during these visits, but it's really nice to just kind of just a comprehensive look at you. Who are you and what are your problems and you have a chance to kind of talk to the physician and come up together with a plan of how you're going to stay healthy. So lots of stuff to do at this visit. Other things that you might get during this visit is an exam. It's not always part of the exam, especially because these visits can actually be done, believe it or not, over the video. You can actually have one of these annual wellness visits with your physicians on a Zoom call like we're doing today. On some of the physicians' computer systems that they use to take notes can call you, and you can actually have one of these exams, these visits actually virtually. But if you happen to be in the office, the physician will likely do an exam on you as well. They'll check your vital signs, your blood pressure, your weight, your height, all that good stuff. They'll listen to your lungs and your ears and your nose and your throat and your belly and your heart and all that good stuff. They'll do that as well. But just so that you know, annual physical exam certainly has all these components, and if you should have one of these annual wellness visits over virtually over the video, certainly still go into your physician for a physical exam if it's possible and safe to do so. I know in COVID everything's got thrown for a loop, but it doesn't replace a physical exam if it's not included in your annual wellness exam. A lot of physicians do it all together though, so it's likely you'll get a physical, especially if you see the physician in person. You're likely going to go ahead and get this as well with your annual wellness. Three main components of an annual wellness visit, which is we shorten it here because it gets to be a mouthful on the slides. AWV is annual wellness visit. So if you see that on the slides moving forward, that's what that is. We do that health risk assessment like we talked about. We look to see if based on like where you live, how old you are, what your family history is, what are some of the things that put you at higher risk for certain conditions. We also check to make sure that you're doing okay. Behavioral, like how are you doing mentally? How are you doing at home? Like when we look at activities of daily living, like what's it like at home for you as far as like getting around? Like, are you falling at home? Do you notice you're stumbling? How do we make your home as safe as possible so that you don't happen to fall and hurt fragile bones? Are you able to get in and out of your house? Are you able to go get food? Are you able to go to your doctors if you need to go? Are you able to get out of your house in an emergency? Like, who helps you? What's your support system? Are you lucky enough to have family that's around that's caring for you? Or, sometimes not biological family, but heart families, is there friends or are there neighbors or there's someone that can help you with what is your social support? And if you're lacking in that, how can we help you with that? This Generations magazines, obviously, they do a lot to make sure seniors have that support system, and what can we do in the community to make sure that you have that support. So that's done, and some of that can actually be done prior to your visit. You may have someone from your doctor's office call you, like some of their assistants call you and do that, and then just review it with your doctor when you see it. Some physicians like to do it that way. Some do it all together. It may look a little different depending on who gives you your annual well, but that's just something that can happen. Vital signs, like I mentioned, at the very least, they're going to check a little bit about that. If they do this over the video, they may ask you, hey, do you got a blood pressure cuff at home? Go ahead and take your blood pressure. Have that ready for the doctor or the provider when they call you. you got to scale at home, jump on it. Like, let them know. I mean, there's stuff that you can do at home too, even if it's a virtual visit or a computer visit to help your doctor kind of see what's going on. And then they're just going to like look just certain things they'll look at. And then the consultation, this is the important thing, right? This is what, in all this information gathering and all this kind of talk that I've done, what's my risk factors for disease? What do I currently have? What am I potential to have? And let's think of a 5-year, 10-year, 1-year plan, right? To go out and tackle that and keep you as healthy as possible. So all of that occurs during this visit. Again, this is kind of a what we've kind of already talked about. We're going to go ahead and look at all of this stuff during the annual wellness visit as we meet with you. One thing I forgot to mention is this is a really good time for your primary care physician, your main medical home physician, to understand who you're seeing other than that person. So what are your specialists? Are you seeing a kidney physician? Are you seeing a cancer physician? Are you seeing a heart doctor? Making sure that they know who you're seeing, making sure that they're coordinating with that physician so that you're not getting conflicting messages when you're going to see those different physicians. Everyone's on the same page. Everyone understands what everybody's plan is to control your health, and so that you understand that and you're on board with it too. And maybe you don't need to see those people anymore either. That's a conversation you can have. And then just one other thing I looked at is, as we age, just like our bodies kind of break down, our mind can break down a little too. Just checking, just a check, just to make sure that there's no issues with memory or cognitive function, meaning how your brain works. Are you able to function like you normally did, or is there maybe some trouble that you're starting to have that people can help you with and prevent that from getting worse, or making sure you're safe at home. And so you'll get asked some funny questions, like asking you to spell world backwards or remember 3 objects. So that's what they're doing. It's just like when they test your heart or lungs, it's just a test of your memory and brain. So don't get alarmed if they ask you that. They're not being silly. It's just a quick screen just to make sure that every part of your body is functioning as well as it can be. And then why they're valuable, I kind of mentioned this before, they identify gaps in care to improve your outcomes. We want to keep you healthy and healthy at home, and with as much burden or as least burden of your illnesses as possible. And we notice people that have had annual wellness visits, the people that take advantage of this free service, have this once a year with their physician. There's 105 way huge increase in colorectal cancer screenings to catch cancers early and hopefully prevent them from going to really devastating results. 50%, like way more vaccinations, keeping you healthy from infectious agents such as pneumonia. A lot more breast cancer screenings get done if people have annual wellness visits and cancers are caught early. And honestly, this is a finance number, but you actually require less care if you get an annual wellness visit. You actually need less services. You're healthier. When you spend in healthcare, it means that you were sick enough that you needed something to happen. We show that you're healthier based on this is a way to kind of measure how healthy you are, and you actually require less services if you've had an annual wellness visit. So where it's not just finding things and then racking up all the things that you need. It actually keeps you, it definitely keeps you healthier based on what we see the spend of the services for these patients. And then, a lot of the physicians surveyed thinks it's a great deal. Physicians are busy too, and physicians are rushed sometimes, and not that it's an excuse. We owe 100% of our attention to you when we see you, and we try to do that. I can guarantee you, every physician, that's the goal and that's the attempt. But sometimes it can be hard to actually see the wholeness of the person. And stopping down and having these visits, they're longer visits. They typically last anywhere from a half an hour minimum to an hour sometimes. Really gives them a comprehensive view of you and really helps them come up with a plan that's going to benefit you the most. And so they really, physicians, when you survey them, they're like me, they really enjoy doing these. They feel like it really helps take care of you and to be a better doctor to you. So physicians love it, patients love it as well. We have a short video kind of later in the presentation that kind of gets perspective of some patients that have had these, and they really like them as well. It's going to change healthcare too. We can be part of a good movement to change healthcare for the better. 6 reasons to get an annual wellness visit every year. I mentioned before, it's free of charge. No copay, even if you've not met your deductible. This is a free visit. This is free. This is what this visit is. And this is any Medicare patient. Certainly Humana and UHC, who we help out here with in Hawaii, honor this as well. So it's a free service. Why not take advantage of something that's free? You build a relationship with your doctor. The mention, like, you establish that relationship with them. Make sure that you feel heard. I'm hoping the end of annual wellness visit, we do a lot of talking as physicians at you during visits. Like, this is your opportunity to do more of the talking. And I'm hoping that each one of you, after you have one of these annual wellness visits, feel heard, feel seen, feel like the physician really understands you, and you together with that physician come up with a plan that's going to benefit you in the coming year. Obviously, I mentioned before, we see it's catch disease in the early manageable stage. Let's catch it early. Let's prevent it from getting worse. Let's keep it in check so that you remain healthy and you don't have the long-term side effects that can happen with disease that continues. You can also, this is a time to plan of action, just like any good game plan. I'm a planner myself. It's a to-do list, right? A checklist. This is what I need to do. Everybody's on the same page. Everybody knows what needs to happen to keep you healthy and safe and well at home for the next year. So this is a great time to discuss ways to improve your health, prevent illness, and create a specific action plan. 2 more. Scheduling early in the year gives you more time. So this is just you can have it, remember what I said, anytime in the calendar year. If you have it in December this year, you could turn around and have it again in January the next if you want to. But scheduling early just gives you a little bit more time, right, to plan your year out. So we do encourage you to plan it sooner rather than later, just to make sure that we keep you as healthy. Remember what I said about people that have had annual wellness visit end up needing less healthcare in the coming year. So this actually helps you with some of the out-of-pocket payments that you might have. It potentially could help you with that. So scheduling early is better for that. And like I mentioned before, annual wellness visits, this is even before COVID, these can be done in your home if you need to. If it's really a burden for you to get out and see your physician, especially with COVID, if you're like, I'm not really sure I want to go into a clinic, we get it, and this is something that you can do virtually with your physician. You can work with your provider to say, what's my options here? And it may not be with your provider. It may be with a trusted partner of your provider. It may be with an advanced nurse practitioner or someone like that works with your provider, that is able to communicate with your provider back to you. But these visits can be done at home as well as in the clinic, as long as there's video. That's the one caveat. You can't just call them on the phone. There has to be video connection between you two. But those can be done virtually. What can you do? So you decided, I convinced you, you're going to have the annual wellness. You get it set up on your calendar. What can you do to prepare yourself for this visit? It's really helpful. It's bring a list of your medications. A list is great. I say get a Ziploc bag, get a Zippy's bag, get a grocery bag and throw your medications in it, and bring it to your office visit. It's super helpful to see what's there. Lists can be deceiving sometimes. They may not have all the information that your provider needs. Just bring your medicines with you. Make sure you're including your vitamins and supplements. Make sure you include the eye drops. Make sure you include the puffers, the inhalers that you use for your lungs. Make sure that you're telling them about any medicines you take for diabetes, such as insulin. Now, if it's in the fridge, obviously don't bring it with you to the appointment, but make sure you're writing those things down so that they know. It's not just pills we're talking about. It's not just pills that you pick up from a prescription. We want to know everything that you're taking with it from a medicinal standpoint, so that we know that we can protect you and let you know of any side effects, and we know we won't prescribe things if you're on certain other things to not harm you. So that's something you can absolutely bring. Make sure that you come knowing, do a little self-check and say, okay, who do I see? So that you make sure the doctor is aware of everybody that you're seeing, specialists, things like that, pharmacists, therapists, home health agencies, non-traditional providers. If you're seeing someone for acupuncture, if you're seeing someone for adjustments or chiropractic, make sure that you're letting the physician know about that so that they're able to see your whole picture and comprehensive picture. And then if you happen to have your immunization records, like think back, when was the last time I had my, did I have my flu shot this year already? Did I have my pneumonia shot? Have I had my COVID shot? Like think back about your immunizations and be ready because you're going to be asked. It's always good to have the answer ready when you're asked, and so that they get the best answer. You can get a little bit more information. I've given you quite a bit, but if you're still wanting more information, or there's certain websites that you can go to that can give you even more. Medicare.gov, this is the official site of Medicare, actually has some information about your yearly wellness visits. You can go to that site. You can also go to, this is also something that's put on by Medicare. This is called Medicare Learning Network. They sometimes call it MLN. They have a nice brochure pamphlet that you can print out or see on your computer about the annual wellness visits. We also have information on our website on MDX.com or MDXHawaii.com website. You can actually have some information there about COVID, about annual wellness, anything. So that's a good site to go to as well. And then I'm going to actually now like pause and like share a video of, I mentioned this earlier, a video that actually it's from the patient perspective. It's one of our nurse practitioners that works with us, Margie Reyes. She interviewed some of her patients that she saw over on Maui that had annual wellness visits and kind of their experience with that. So I'm going to pause really quickly and load up the video. I think I may have to stop share and come back in if it doesn't work. Give me 1 second. It worked when we tried it, but of course, you know. Here we go. Let's try it. We'll see. Adrian, give me a thumbs up if you can hear it when it starts, okay?
So why did you decide to have an annual wellness visit?
I recall getting a phone call from somebody other than Dr. Mitchell's office, and I think it was from somebody in your staff, perhaps yourself.
Reminders of things that I need to do.
Is just checking on when I need to have flu shots, shingle shots, and also colonoscopy.
It's good to be reminded of things, all right? And there were some good reminders about the medications and things like that.
It's really important. You should take the shot.
Yes. Pneumonia shots, right?
Pneumonia shot.
And influenza shots every year.
Especially the house.
Okay.
The homes is really important. But once they get slippery, make sure you get enough light around.
Oh yes, we talked about
the bathroom and the shower. Make sure you have railings that support you to balance your body.
People, when they reach their 70s or 80s, do have a tendency to fall more often, and that it can be catastrophic.
Did you have the opportunity to discuss your medication?
I did, always, every time I go.
So you have a better understanding
better
of what
understanding of like what and what time of day to take it. Like that. So, but I was doing that. It was like a good thing.
Very good.
Well, my primary takeaway is that I need to do something about taking one medication. I work out every day, go to the gym 6 days a week.
Yeah, I exercise regularly. I go to the gym a couple times a week and to the swimming pool.
And we did discuss also the importance of having an advanced health directive.
Yes, we did.
Today, after this meeting, we're going to see our attorney about our trust.
I know it's very important based upon my husband's passing.
What advice would you give other patients in a similar situation?
Definitely to do it. I mean, it was harmless. You didn't have to get undressed.
Oh, I would definitely advise them to take advantage of it.
All right. See if we can get it. All right. Believe it or not, I've actually I've come to the end of my portion as far as the slides go, but I would love to hear from you guys if there's any questions, if I can answer anything about annual wellness, any questions that you have. Happy to take the time to chat with you. Oh, I see some questions. I'm seeing the chat light up. Let me log on here. Oh, thank you, Kimberly. I'm glad you enjoyed that video. Yeah, I thought it was, it's really great to hear from everyone. Now's your chance, guys. Any questions at all?
Dr. Amy, I just got off the phone with someone trying to get in. I'm not sure why, but I want to remind everybody that if you have a friend or somebody that missed this webinar, you can also go on generations808.com and all of our past webinars will be posted. So give us a couple days for this one. But yeah, somebody just called. She's like, I've been trying to get on and I don't know what was wrong. So I told her to that we'll have it on our webpage after.
Absolutely. Yeah,
So,
technology is great until it doesn't work.
yeah. I had a question. So if you don't have United or Humana, you don't get these added services, correct?
No, actually, that's
Oh.
anybody with Medicare. So if you are a Medicare patient with any of the plans, this is a service for you. So you should talk with your regular doctor, reach out to your doctor, and inquire about how they're scheduling their annual wellness visits. This is a Medicare benefit.
Okay. Even through like if they're military, they still would qualify, even if
they have Medicare. So yes, if they have Medicare, yep. Whether it's traditional Medicare that you earn because you're working, or if it's through a Medicare Advantage plan, yes, you qualify for this. So 65 and above. Good question.
Anybody else have any questions? You can put it in the chat or you can put in the Q&A. Oh, I see one. And it says, and if the person does not have Medicare, is this covered or what's the cost?
That's a good question. I think, the best advice I can give you is to go to whatever insurance that you have. If you go, every insurance company should have what's called an evidence of coverage or a benefit manual that you get yearly. I would look through that or call the customer service agent on the back of your card to inquire about it. At the very bare minimum, physicians always like to bring their patients in for an annual physical and history. And I bet you a lot of the physicians would offer something like this. It would be up to the physician to and your plan to let you know what your costs would be for that. It would probably be a copay for an office visit would be my guess, but best advice I can give you is to look into your insurance brochure that you get. The shingles vaccination, I am for it. If you qualify, I think it is, it's one of the harder vaccines to get. I'll be honest with you. A lot of my patients say that this one hurts. This one, a lot of arm soreness and just generally not feeling so great after you get it. It's a 2-shot regimen. But I can tell you, shingles is horrific. It's horrible. The pain that people get, some of the scarring that you get from all of the vessels being open is just a lot of heartache and suffering with shingles. And so I'm a believer in the shot. I think if you can do whatever you can to prevent it is great. Anybody that's had chicken pox could get shingles. Chicken pox, the shingles is the same. What causes shingles is the same virus that we all got as kids as chicken pox. It believe it or not, it's kind of creepy, but it kind of lives in your body even after you've had it, and it can become active again. And there's certain things that can happen. Sometimes we don't know, but you're always at risk of developing shingles, and the vaccination can certainly cut down on you having that. But talk to your doctor, talk to your regular provider to make sure you qualify for it. But if you do, when you have that conversation, I would advise getting it. Okay, here we go. First one from Kathy. Kathy said, I tried to stick with. Oh my, okay. Doesn't do, if he is employed and not able to do it. Okay, so Kathy, I see your last name. There is Adrian, I don't know if you can maybe provide your contact information in the chat. If you let us know, just privately message, I don't want to put your mom's information on blast, but if you could privately let us know who your mom is, we can certainly work with your provider to make sure she gets her annual wellness. Absolutely. And then anonymous timing and okay, how part should they be administered? So what they're recommending with COVID vaccines is they like you to stay with your COVID vaccine. They kind of want you to wait about at least 6 to 8 weeks after in between your vaccine. So if you've had your COVID vaccine, I'd give it at least 6 to 8 weeks before you get your first round of your shingles vaccine. If you've recently got your shingles vaccine, that's a hard one for me because I certainly want you to be protected from COVID, especially with what's happening here. So I would talk to your doctor about that one, but they do recommend kind of holding off on other vaccinations after your COVID vaccine for at least 6 to 8 weeks. Hopefully that answered your question. Great questions. Hopefully everybody's having good lunch. You can chat, you can tell us what you're having for lunch, too. We can all live vicariously through you. Hopefully soon we'll be able to do together and share lunch together again.
So I just put in some information in the chat. If we want to start an email list so that you can be reminded of upcoming webinars, or I also was going to send out the recording of this to any attendees that wanted to have it, straight on their computer. So please send me an email at cynthia@generations808.com, or you can put your information in the chat privately to me. I would love to be able to provide more webinar information to everyone, as well as the information from today. So if you'd like that information, please feel free to email me. Want to get a good email list going out so that we can increase our attendance for this. Also, any feedback or any private questions you may have. Dr. Amy and Adrian, do you have your contact information up somewhere that if anyone wants to contact you directly, they can do that? Oh, there we go. There's Adrian.
And Adrian can get in touch with me. Like Adrian and I are, no worries.
So if any of you have private conversations, maybe Kathy, you want to email Adrian specifically in regards to mom, please do that. They are here. They're a wonderful resource for not only Generations Magazine, but for Oahu and for all the other islands. So please contact them directly if you have any future other questions. Do you guys have anything else, Dr. Amy or Adrian, that you wanted to share?
Yeah, I have something. So on our Facebook, MDXHawaii.com Facebook with HawaiiGotVaccinated.com and the Department of Health Services, with them, we're giving away a mini iPad, getting up to 2,000 likes on our page. So we already gave away one early July, I believe, or at the end of June. And now we're trying to give away another, and it's, promotion through the HawaiiGotVaccination.com. So, and then we're also sponsoring our this October webinar, and we're going to have someone very special from Humana come and speak to us about Medicare. So please mark your calendars, and I believe it's October 20th from 11:30 to 1 p.m. So please do plan to join us for October session as well. Yes,
that's a good reminder. Yes, Ship will be speaking next month, September 22nd, we will have MDX sponsor the October webinar. So I will also be sending out that flyer. So again, if any of you want to be put on our email list, please send me an email, and I'd be more than happy to do that. I just liked MDX Hawaii on my Facebook, so cross
Yay.
my fingers for my iPad. No, but yeah, it's yeah, you guys are doing such great work, so it's really awesome. Thank you.
Thank you.
Well, no, thank you for the opportunity to come and speak with you guys. And I know you hear it quite a bit, but I do encourage, I know it's a personal choice and it's something that you should absolutely talk to your physician about, but I encourage everyone to get vaccinated if they have not already been vaccinated for COVID-19. We are definitely in a crisis here in Hawaii in our hospital systems and our healthcare systems, and we're seeing like the vast majority of the patients that are suffering so horrifically from COVID-19 are unvaccinated. Vaccination does protect you from severe, it goes a long, long way to protecting you against severe illness and getting COVID-19 so severe that you wind up in the hospital or dying from it. So it is a tool belt, it is a shield for you, you know, in your fight in severe damage from COVID-19. It's so prevalent in our community right now. The odds of you catching it are quite high. So you want to do whatever you can do to prevent you from having serious suffering consequences from it. Vaccination can absolutely do that. If you have been fully vaccinated but are suffering from slow acting or poor immune system, so if you're taking a medication for cancer, if you've had a transplant or an organ transplanted into your body, if you take medicines to tamp down your immune system, you are eligible right now to get a third booster shot to hopefully prevent you from contacting COVID-19. Make sure that you're looking, One Oahu, Hawaii Department of Health all have websites that show you where you can get your vaccination. If you've not been vaccinated but are interested in doing so, same sites as well. Vaccinations are free. It doesn't matter what insurance you have or no insurance, they are free to you. I believe they are safe. This is not an experimental medication. This type of vaccine has been used for other diseases in the past. It's a myth that it's experimental. And I believe it to be safe for the vast majority of people. It is a personal decision. It's something that you should talk with your healthcare provider about. But I strongly encourage you to do so. I immediately rolled up my sleeve to get mine as soon as I was eligible, and I will be rolling my sleeve up again to get my booster as soon as it's recommended for the general public. It is a game changer in our fight against COVID-19, and I strongly recommend it.
So I have, Dr. Rhine, I have a couple of comments and a question. So question to you is, do you need to take the booster shot same manufacturer, or it doesn't matter? So if I got Pfizer, do I need to get Pfizer? It doesn't matter, right?
No, you know, we're gonna wait for the official, but no, as of now, it doesn't.
Okay.
The one thing that we do ask is, like, at the moment, if you did get a Pfizer or Moderna, which are slightly different than the Johnson & Johnson slot, we do recommend that you get a Pfizer or a Moderna rather than the Johnson & Johnson, because it's a little bit different. And we're still waiting on guidance on what to do about the Johnson & Johnson right now, the one-shot regimen. If you did receive that, not very many people in Hawaii got that one, actually. Compared to the mainland, over 80% of the vaccinations already given to Hawaii, and we are, oh gosh, we're approaching over 2 million vaccines given. 61% of our population already have been fully vaccinated, 72% and eligible, meaning 12 and above, have been vaccinated. Over 80% of those were vaccinated with either Pfizer or Moderna. We did not have very much Johnson & Johnson use here on the islands. And so the majority of people out there can get either a Pfizer or a Moderna. It does not matter. You do not have to stick with your same manufacturer at this point.
So I guess the second or another comment is on our mdxhawaii.com on homepage, we have a really, really good video that actually you could watch on vaccination. So we have a couple of local physicians, including Dr. Rhine, did a video on educating the focus on vaccination. And then I guess third comment that I need to make is one of my actually good friends just passed away from COVID-19, and I just found it this morning. So please do get vaccinated.
I'm so sorry,
yeah,
Adrian.
yeah, just
My condolences.
and she's a lot younger than I am. She's like 4 or 5 years younger, 5 years younger than I am. So it's just, you know, she had a heart complications from COVID. So
I mean, if you look at who's becoming sick right now, of the over 300 people currently hospitalized with COVID, about more than half of them are less than 50 years of age. It's devastating.
So now it's impacting younger folks than anything else. So anyway.
But we all know here in Hawaii, we love with the multi-generation households, you know, what you do, even if you're young and healthy, getting vaccinated is not only protecting yourself, but it is a sign of kuleana to your community, because you're protecting the people that cannot get vaccinated or the elderly that could get severe symptoms. And so don't do it just for you, do it for your community, do it for your loved ones, do it for your family, is a reason as well to get vaccinated.
Well, thank you, ladies. We appreciate you coming on and doing this presentation for us. Yeah, I mean, I have a 90 and 93-year-old grandparents, and I see them at least twice a week. So it's very important to me too that, you know, everyone tries to stay safe. Plus, I have a daughter that goes to elementary school right now, and she can't get vaccinated. So yes, I also encourage people to get vaccinated. But thank you. I do want to finish with saying thank you to our sponsors, FBI, as well as Declutter Hawaii and Senior Move Managers. And thank you to MDX, Adrian, and Dr. Amy for being on this webinar today. Again, this is recorded, so it will be on our webpage as well as sent out to those who would like the link. In addition to these brown bag webinars, we have our next one coming up on September 22nd with SHIP, and then October 20th with MDX again. Also, we have a radio podcast every Sunday, 8 to 9 a.m. on 101.1 KORL Hawaii's Classic Rock FM and Spectrum Channel 883. And then also on our webpage at generations808.com. So if you have no other questions, thank you for attending, and we'll see you on September 22nd.
Thank you very much, everyone. Thanks so much. It was really nice to see you, Brittany. Yes, thank you, everyone. Bye-bye. Stay safe.